Welcome back to the RX class. I'm your host, Dr. Guang Chen. Thank you for your support so far, and for the listeners who've been tuning in on YouTube, been great to have you. In the last couple of weeks, I've diagnosed several cancers, and some of these conversations I've had with patients I think will be helpful for the listeners at home. Cancer is a very prevalent disease, and I'm sure many of you and perhaps your families have been touched by cancer. Cancer journey is complex, and I'd like to share with you some of my insights to help you or your family along the way. Quick disclaimer before we proceed. Please note that throughout the podcast episode, the information presented is general in nature and use your own risk. Complex concepts may be oversimplified for entertainment purposes. Symptoms and medical conditions, as well as the diagnosis and treatment of these conditions, may be mentioned. The information presented does not constitute the practice of medicine nor replace medical advice from a licensed medical professional. Do not rely on the information to make decisions about your or someone else's health. Please seek help from a certified health practitioner if you have concerns or symptoms. In terms of cancer, I'd like to give you a bit of a rundown of how I think about it. Firstly, perhaps we talk about, what is cancer? But to understand what is cancer, we need to know what is normal and what is healthy cells and tissue. To start off with, we all start out as a single cell zygote within our mother's womb. And as the zygote divides, it becomes an embryo and ultimately into a fetus. Along the way, the cells differentiate and they take on essentially a permanent role. Skin cells become skin cells. Bone cells become bone cells. This is obviously a very simplified approach. But overall, there's a balance in terms of how cells grow and how they die and how they recycle and if they're recycled. If this balance is interrupted, and that's where cancer can occur. Because with cancer, the cells essentially replicate uncontrollably, and they also have the ability to migrate and metastasize to other locations. The changes that are required often occur over months, years, and most commonly, decades. And these changes can occur within the cells themselves. Damage to the DNA can occur through exposure to radiation, chemicals, and various other carcinogens, as well as changes outside the cells. For example, the immune system. Immune system normally, other than fighting bacteria, viruses, are also important in the surveillance of cells that may go awry. In patients who may have a genetic predisposition, often they start out with a genetic defect. And sometimes these defects are important in protecting us and cells from becoming cancerous. You may have heard about the breast cancer gene, the BRCA1 or BRCA2. You may have heard about the bowel cancer gene called FAP. These genes, as an example, are what we call tumor suppressor genes. These genes, when they're normal, essentially help fix problems. However, in patients who have the abnormality, they're born without that particular gene, and so therefore, the overall number of steps required to become a cancerous cell is significantly reduced. And in many cases, these patients develop their associated cancer in their early 20s and 30s. As opposed to someone else without them, it might occur in their 50s, 60s, and 70s. We typically diagnose cancer in two ways. Firstly, in the first instance, sometimes cancers are diagnosed accidentally or incidentally. We call these incidentalomas. Patients often present with non-specific symptoms or symptoms related to another condition, and in the process of investigating those symptoms, we find the particular cancer or tumor. The second type are patients presenting with symptoms related to the actual tumor or cancer itself. For example, lung cancer may present with coughing, chest discomfort, hemoptysis, which is the coughing of blood. Bowel cancer or colon cancer may present with abdominal pain, bloating, changes in bowel habit, and bleeding within the stools. Generally speaking, when cancers are identified with symptoms associated with them, the prognosis is often poor, as these cancers have grown large and they have perhaps caused localized pressure or destruction of surrounding tissues. Once we have identified of a possible lesion, most common way that we diagnose cancer is through a biopsy. Biopsies usually involve the need to obtain tissue or cell material. This can be obtained in different ways depending on the nature and the location of the tumor. Some places are easier to get to, others are more tricky. So, for example, with the skin cancer, it's obviously easy to obtain a biopsy at the skin. However, if you've got a very tricky brain tumor, it may involve open brain surgery to obtain the initial diagnosis. Interestingly, there are some tumors that we can diagnose based on blood tests alone or on imaging. However, these are not common, and I would speak to your health professional regarding those if you've got specific questions. Once the diagnosis of the cancer has been confirmed, and that's usually, as I said, through microscopic investigation, at this stage, we now know the organ location, for example, with the lung cancer, and also now with the histology, we know the cell type. And this is important because different cell types behave very differently. And at the time of the microscopic investigation, the pathologist will also typically assign a grade, which is to tell us about how different these cells look to their normal cells. And generally, the higher the grade, the more aggressive the tumor. Next, we would stage the tumor, and that's to work out to see if the tumor is localized, whether it's spread to local lymph nodes or it has spread to other tissues. And the staging process is different for different types of tumors. So the typical system for solid organ tumors, such as lung cancer, bowel cancer, bladder cancer, we use a stage 1 to 4 or a TNM or tumor lymph node metastasis system. Other cancers, such as related to the blood system or brain tumors, have a very different staging system given their mode of spread is different to the solid tumors. Generally speaking, once we have the information about the organ location, the cell type, the grade, and the stage, we would generally have a fairly good idea of the general trend of a population of patients. And so we will talk about the prognosis. The prognosis is somewhat complicated depending on the different populations. And so we have population data for example, all cancers, and then we've got more specific data about certain populations related to their age, their gender, other medical conditions, their various grades and stages, as well as if they've got special types of tumors. At the moment, some tumors can carry special genes, and they may have more favorable or less favorable prognosis. And in terms of prognosis, we would normally talk about survival. And survival typically means that out of 100 or 1,000 patients, how many patients would remain alive after 1 year, 5 year, 10 years. And along with that, we use terms such as median survival, which is the middle person out of 100 patients. The 50th person is likely to be alive at 5 years, as an example, or 3 years, 10 years, depending on the type of cancer. Other terms we might use includes disease-free survival, in which the cancer after treatment remains undetectable. Or we may talk about progression-free survival, where the cancer remains stable and is not determined to measure, and through various measurements is not shown to grow in size or to cause more complications. Next, cancer treatment. Today we have a multitude of different cancer treatments available, and there are more and more coming every month as we speak. The first treatment is perhaps to do nothing, and that might sound silly. However, there are certain cancers where the treatment can actually be more harmful than watchful waiting. This is obviously a small number of cases, and I would encourage you to speak to your specialist regarding that. Next, for many solid organ tumors, surgery is an important option. Generally, with surgery, there are two types of surgery. One is with curative intent, which means that we would do the surgery to remove the tumor and its surrounding lymph nodes with the attempt of removing all tumor and therefore successfully curing the patient. We sometimes also perform surgery for what we call palliative reasons. And this is often to provide a quality of life. And for example, if we've got a bowel cancer, which is causing a bowel obstruction or a localized blockage, we would perform a surgery to unblock the bowel to ensure that we've got normal flow of the stools. Next, we have chemotherapy. We can talk about, I guess, traditional chemotherapy versus the newer types of therapies. Chemotherapy typically is taken either via tablets or via infusion. Many of these act on the rapidly dividing cells, causing these cells to die more quickly than healthier cells. Unfortunately, some other healthy cells may be taken as collateral, and that's the reason why cancer patients receiving chemotherapy often lose their hair, have troubles with their nails, and also gastrointestinal side effects because these cells are also rapidly dividing as well. Today, other options including hormonal treatment as well as immunotherapy, which has been very, very effective in very specific types of tumors, in particular, for example, melanoma. Next, radiation, which is the use of specialized X-rays to target locations effectively to cause rapid cell death or to burn the tumor. Other options include using various nuclear medicine agents, either through an infusion or through an implant, again, to locally cause tissue damage and tissue death. Cancer treatments can usually be divided into neoadjuvant, which means to have prior to generally surgery, or adjuvant, which is to occur after surgery. As the cancer treatments progress, we use different parameters, whether that be blood tests or scans, and also specialized investigations to monitor the progress of the cancer. We talk about response rate, which is whether we're getting a complete response, so the tumors have essentially disappeared and we no longer see them on the tests, or there may be a partial response where we're seeing a reduction in the tumor size, or there may be no response. As the cancer treatment progresses, often we will be able to give you more updates about the prognosis, and the prognosis may improve, remain unchanged, or perhaps even deteriorate depending on the responses of the therapies. And lastly, I'd like to make a note about palliative care therapy. Palliative care is really the management of patients and their family who have an active, progressive, advanced disease with a little chance of cure. Palliative care, unfortunately, sometimes gets a bad rap as it is commonly associated with end of life and death, but that is not so. Palliative care is the management of all aspects of patients with advanced cancer. They're able to help with symptoms including nausea, hair loss, gastrointestinal symptoms, pain. Very good at helping the carer as well as help setting up at home to ensure that the patients are comfortable whenever they're receiving their treatments. And yes, they are also important in end of life. I hope this conversation was helpful for you. If you have enjoyed it, please subscribe and give me a 5-star review. Please reach out if you've got any other questions or suggestions. I'll see you next time.